Hello, my name is Beverly Brock, and I am in ECPI University's Master of Science in Nursing, and we're education majors. This is Nursing 660, and my video tonight is on simulation, lesson plan for BSN pre-licensure nursing students. My overall goal for this lesson plan is to teach pre-licensure nursing students the goal of simulation. And this goal is to be reached before their transition into the clinical practicum in which they're assigned. All nursing programs have a clinical practicum, and in the clinical practicum the nurses go to practice the skills learned and to kind of apply theory and knowledge into the clinical setting. And basically what they're doing, everything that they've learned in a specific, say, semester or in the first year, they go to the clinical setting to practice. And what it is, in practice, they're going to do certain skills. They'll take blood pressures, they'll do medications, they'll do different kinds of teachings, and all these things will be done at the bedside of the patient, and it can also include family members. They're not only going to be engaging with the patient, family members. And the students have to also understand and be able to deal with diverse populations. In nursing, we have a diversity, ethnicity, culture. All of that's something that we all have to involve ourselves in whenever we're in the clinical setting. And no two people are going to be the same. And that's something that they will learn in the simulation lab. Now, my objectives. How do I see myself getting these students to the realization of understanding what simulation is? My first objective, the learners will feel safe in the simulation learning environment. My next objective, the learners will understand the debriefing process and how it's designed to enhance learning. The learners will understand the terminology of simulation and how simulation enhances the learning of body systems. And my major focus is going to be on a chronic illness and an acute illness. And I want the students to understand how a person can come to the hospital in a chronic state that has had an acute exacerbation. And with this happening, they need to understand how to take care of these patients. And if they can do this in a simulated environment with experimental learning, I think they would grasp the concept of taking care of the patient in the actual patient care setting. Now, a safe learning environment. The National League of Nursing is one of the entities that does provide templates for facilitators and for educators to design scenarios in simulation for students based on the contents of their education curriculum or their plan. And whenever the facilitator is doing this or the educator is doing this, they must keep in mind that the students should feel safe in the learning environment, and the students should not have any psychological or emotional detachments during the simulation process. And we as educators have to remember, we have to use positive reinforcement or positive redirection. In the event that someone does something that we may not understand why they did it, we have to be positive. We don't want to humiliate the students. We want the students to feel safe, and we want them to always feel that they can approach us as educators and have good student outcomes at the end of anything that we start, as far as, say, our education plan or anything that we're planning on teaching, a skill or anything of that nature in the clinical environment. We want them to feel safe and to trust us and be confident in us as educators. Now, the terminology of simulation in the simulation environments. The students should understand the difference in the words used by the facilitator. We may use high fidelity, which is how the scenario plays out. What kind of mannequin are we using? We'll use a mannequin that can speak. We'll use a mannequin that can sneeze. We'll use a mannequin that can make sounds. His eyes can move. And in this with this kind of mannequin, it's usually pretty good for the students to interact with because he can talk and he will respond to their treatment. Low fidelity could be a mannequin that we use for CPR. This one may not talk, but it can also be programmed for them whenever they're doing chest compressions and breathing into the mannequin. It'll show whether their breaths are being effective breathing. And also moulage. Moulage is whenever we're in the high fidelity lab. Say if we have someone who throws up or mimics throwing up, we can have emesis that looks just like someone threw up. We can also have just different things, glasses. We can have wigs. If we have a pediatric patient, we can have that little patient throw up. These are the things that make the setting real life. Pre-brief, that's what I'm doing right now. We would go in and we talk about what's going to happen in the scenario, what's expected of them, and debrief. In the debriefing setting, we're going to talk about what happened. We're going to analyze. We're going to do all of those things so the learner can understand what and why. Here is a simulation picture here, and as I said, it's designed to enhance learning. And the students in this environment, this mimics the simulation center where I've been doing my practicum. We have a two-way window here where we can see out, but no one can see in. And there's only the people in the practicing environment, and there can also be a streaming going on where the students who are in another room can also see what's happening. But in this setting, everything that happens in that environment stays in that environment, and it's judgment-free. No one's going to judge them. No one's going to say anything about what they're doing or how they've done it. Now, the overall process here with simulation, what we're trying to get the students to do is critically think, use their clinical reasoning skills and good clinical judgment skills. In order to do that, this little picture here shows you about simulation and the assessment, the intervention. They're going to communicate by SBAR, and the overall what we're trying to get them to do is use the nursing process. If they use the nursing process, they can get through the simulation, and in the simulation lab, they will get understanding. They'll understand how critical thinking, clinical reasoning, and clinical judgment aids them whenever they're doing their assessments. And if we can get the students to get into a mode of thinking or understand why they made a decision, what brought them to the decision, and it's all done with the critical thinking and the clinical reasoning. How? Can you tell me what? Can you tell me why? But we always want to be positive with the students. We want to promote positive. We don't want the student to feel like they're in an environment where there is not going to be a focused assessment or focused learning on their part. Now, the assessment of my learners, demonstrating the objectives. The question is, how am I going to get them? How was I going to get them to understand? In the debriefing session that you see here, if you look at this picture, this is what happens in debriefing. But in my debriefing, the learners will verbalize understanding of the safe simulation environment. The learners will verbalize and understand the importance of the debriefing process and how it impacts learning. The learners will verbalize their understanding of the simulator as it relates to acute and chronic illness of body systems. And if I can do all of this and get these students to understand how important simulation is, and in that simulation environment, how I plan to make sure that when they do their transition to practice, that they understand why and how they made decisions about clinical judgment and how they use their clinical reasoning and critical thinking skills to assess a patient who had a chronic illness, who had an exacerbation, and it became an acute illness. If they can grasp the concept on how this is to be done, and if I can emphasize to them enough the importance of simulation, their being in a safe environment to practice prior to going to their practicums, I think these students will have good outcomes. And I feel like with the use of simulation in our education, we can help students pass their NCLEX. There has been some documentation, and it was done by the National Council for State Boards of Nursing, that it didn't affect the NCLEX, but I feel like it will. If we can help these students, I feel like our NCLEX pass rates will be at 100%. Thank you.